Greetings, everybody. I'm Dr. Bruce Carlton from BC Children's Hospital. I'm a professor of pediatrics at the University of British Columbia and also director of the Pharmaceutical Outcomes Program. And one of the messages that I'd like to talk to you about today is adverse drug reactions and the importance of ED physicians in managing and recognizing these events. Most people aren't aware that adverse drug reactions are actually the 5th leading cause of death in North America, and that does not mean medication errors or overdoses that are intentional or otherwise accidental. This is actually properly prescribed drugs are actually the 5th leading cause of death. And it's particularly a problem in children, where young children cannot evaluate and express their response to medication as adults do. So they can't tell us whether or not their joints are hurting now as a result of drug therapy, or myalgia is occurring, and other kinds of issues, particularly in very young children. So it's a difficult issue to address. I think that the major public health threat that drug reactions pose mean that we need to come up with some solutions to this particular problem. And it seems to me that that in the emergency room, where patients come to be treated for a variety of diseases and symptoms, that drug reactions actually may be the cause of some of those presenting symptoms, and they should always be considered when emergency room physicians are treating individual patients, that drugs may in fact be responsible, or at least partly responsible, for the symptomatology, disease symptomatology that they see. And recognition remains a critical problem for adverse drug reaction solution finding, because 95% of all adverse reactions are never reported to federal regulators. There's actually primary literature to support that claim. And so recognizing that drugs may be responsible is the first step in finding solutions to drug safety problems in pediatrics.